Okay, so I'm gonna speed run basically topic 1 to topic 6. Um, yeah, topic 1 to topic 6. Then tomorrow, if I have time, let's see if I have time. Do I have time? Do I have time tomorrow? Anytime tomorrow? No, not really. Right. I'm gonna have to wake up early tomorrow. Yeah, so I'm gonna do 1 to 6 today, and then 7, 8, 9, and the rest tomorrow morning. That's the plan. Um, so yeah, I'm gonna do 1 to 6, and hopefully I can get it done. Alright. So let's keep it nice and simple and quick. So first topic is about social medicine. Definition, history, objective, task, methods. Okay. So definition. Okay. Now I don't know if there's a single concrete definition, right? But this is what I put down. So social med is the study of health and factors affecting health, right? Public, I'm not sure if that's the right word to put in, but yeah, I put it. So the study of public health and factors affecting it. And obviously, health can consist of personal, group, and public health. But in social med, you mainly focus on group and public. Okay. Now, what are the factors affecting health? Social, physical, biological. But if we look at this diagram, which everybody and their babies know, right? Social, physical, mental factors that affect health. Lifestyle is within the circle. Why is it within the circle? Because we can alter it. We can have some management of it. But with the environment is outside the circle, we don't have any management over it. The environment affects us. We don't affect it. Now, health. If she was to, say what health is, you know what it is. State of complete blah blah blah. Now, objectives. Objectives. No, let's go history. History is here. Now, history just talk about the main 4 points. You can add whatever you want if you want, but I'm just gonna stick with this. So, first, Johann Peter Frank, mid 18th century. I don't know the exact date. It might be 1849. I don't know. I want to say mid 18th century. Well, that doesn't make sense actually. If it is 1849, I don't know. Anyway, Johann Peter Frank. Okay. What did he do? He basically was advising the government to do something. He was saying to the government, yo, you lot, you need to make a universal healthcare system, like a a public health, god damn it, a primary healthcare system, right? The reason he was saying this is because at that time, the government was only taking care of the army medically, yeah. The general public, they weren't taking care of him in the same way. Okay. But the thing is, they wanted people from the general populace to join the army. But how can you do that? They're bloody ill. They don't have any medical treatments. This guy was like, yo, you lot, the government, need to start putting an effort into primary healthcare, right? And so, in that way, if you make the people healthier, yeah, then they may join your bloody army. So he basically was able to get the government to make some form of a primary healthcare system, like a police for health. Yeah. Okay. Second one. A union was made for doctors in 1901 in Bulgaria. 1901. So we got 18 here and 19 here. Alright. World Health Organization made 1948. Why is the World Health Organization? Why was it made? It was made on the premise of making basically universal is for ensuring the highest level of health for all people, something like that. Then 1 year after 1949, social med department, the first social med department was made in Plovdiv. Okay, Johan Union, yeah. They kind of sound the same, and 1819. And World Health Organization and this Plovdiv thing, 48, 49. It's 1 year. It's 1 year after. Okay, Johan Union, World Health Organization, and the department, 1 year after. Okay. Let's go on objectives. Objectives. Now, this isn't fixed as well, so you might need to just guess whatever answer it is, because I can't guarantee you it's going to be just this, or it might be this. It's likely to be this, but it could be, some of the things here. But they do overlap, so I'll show you. Let's start with this objective. First one here, health and the factors influencing health. That's objective number 1. What is this basically? Is exactly the same as the definition. Yeah. A study of health and the factors influencing health. Social, biological, political, environmental, all that stuff. Next, I made a nice little hammer on a whatever you're whacking on, what the judge is whacking on. Policy and strategy of implementing policies, healthcare policies. You can look at the other essays I made. Yeah, it talks about all these articles that's been made, and obviously the government. So you can talk about how there's a national health strategy and a national program and that sort of thing, and how the council of ministers, they adopt the NHS national health strategy. Next, management and legislation. That's kind of the same thing. Maybe management and legislation. Legislation, yeah, this is kind of the same thing, isn't it? Maybe just how they implement different articles, like the labor code and specific legislation for women and kids. Next, education and promotion. What do I mean by education and promotion? Education, so we talked about the parents before they're born, how to teach them to basically have the right knowledge in upbringing the child healthily. And promotion, you could just link that to primary prevention, and that could be things like folic acid and vitamin D, that sort of thing. Yeah, education, promotion, spreading the word to people. Next, 5th, health economics. Right, what do we mean by health economics? Health economics. How does the economic environment influence people's health? So I'm thinking something like social gradient. Social gradient could be a factor in affecting health economics. Oh yeah, another big thing as well. What's the biggest contributor to health in a country? It's how the economics, basically, how they support maternal health, and how they support kids' health as well. biggest factors, indicators for economic prosperity. All right. That was the first possible list of objectives, but this one could also be as well. So you can have etiology, prophylaxis, therapy, and rehabilitation. Etiology, so we're trying to look at the factors which affect health. Guess what is the same as this? Prophylaxis, primary, secondary, tertiary, guess what? It's the same as this thing here. Education, promotion. Therapy, eliminating risk factors, okay? What could be risk factors? Direct and indirect, okay? Direct being genetic, indirect being pollution, and these kind of things. How do you do that? You can use these I don't know how you would call it, but these prophylaxis measures, right? So face masks, vitamin D, iodine. Yeah. What else can you do? Eliminate using healthcare structure, the healthcare structure, primary healthcare, specialist care, and you go up the ladder. You go up the ladder. Primary healthcare, secondary healthcare, tertiary healthcare. Tertiary healthcare being the most specialist of care, and then you can say, all right, what's the type of specialist care? Selena, or something like that, which is basically a gynae hospital. All right, rehabilitation. So this is the main job of social medical doctors, because he was like in the first lecture, all right, what's the difference between a social med doctor and a normal doctor? This is, we are interested in a non-medical aspect of healthcare, of health. Yeah, we're looking at the health of the society, not just the individualistic, health focus. So the task is interested in the health of the community. Right. And so yeah, focusing on integration is one key part of the tasks, one of the many tasks. Okay, I know this is looking all messy, but I tried to make this video 100 times. All right, tasks. Okay, so this is the next point in our thingy question. We've done definition, we've done history, we've done objectives, now we're doing tasks. Tasks has 4 components. Again, you could see a little bit of overlap. First task, we look at epidemiology. All right, like I was saying, there's direct and indirect, direct genetic, indirect environmental pollution. Yeah. Sociological. Now, main thing is this social gradient. Okay. I can't give you an example straight away, but there's 9 different types. It's in my Notion. You can look at it. Next, medical demography. Okay. Now, this is just like how um the demography can affect health. Maybe how maybe those pyramids. Is that one thing? Those pyramids. Uh, yeah, I can't really remember demography. And I'm gonna need to look at that. But yeah, you can kind of make something up how a certain demographic. Oh, how he was on about gypsies. The gypsies, they're isolated. The gypsies are isolated. He said something like that, didn't he? Just make some up, And then statistics. So in social med, we love prevalence, we love incidence, how they were on about case fatality ratio and all this other stuff as well. Prevalence means how many present cases there are. Incidents, how many new cases there are. Okay. So 4 tasks. Epidemiology. So how it starts sociologically. How is it influenced by social factors, medical demography, and stats. Yeah. Finally is methods, and I don't have methods. I don't know. Don't even know what it means by method. But that's most of it anyway. So yeah, I'm gonna leave it there.